Good evening, everybody, and thank you for joining us today for the lecture with Dr. Hozack. My name is Melanie Ionase, and I am a physician relations specialist here at Rothman. Again, I want to thank you all for joining us. You are going to be listening in on Is Your Smartphone Causing Hand and Wrist Pain? Things to Know with our orthopedic surgeon, Dr. Bryan Hozack. Dr. Bryan Hozack locations are in Egg Harbor Township, Cape May, and Manahawkin. Just a few quick notes. This webinar is being recorded, so you'll be able to receive it at the end of this lecture within 5 to 7 days. And also, if you have any questions, we'd love you to participate in it. Please put it in the Q&A box at the bottom of your screen, or it could be at the top of your screen as well. And so in just a moment, I'm going to tell Dr. Hozack to take it away. And Dr. Hozack, thank you for joining us tonight.
All right, thank you. Good evening, everyone. I am Bryan Hozack, and I wanted to welcome you to this talk about smartphone thumb. I am planning to go through several conditions that develop in thumbs that may be exacerbated by cell phone use. This is by no means a complete report on the problems with cell phones, but just a few topics that will hopefully address some concerns that many patients have in my office. As a quick introduction, again, my name is Bryan Hozack. I went to Jefferson Medical School in Philadelphia. I stayed there for my orthopedic residency, where I trained with a lot of the Rothman surgeons. I continued my training in Oklahoma City, where I did my hand fellowship. I'm one of the hand surgeons at the Rothman Institute in the South Jersey region. I cover Egg Harbor Township, Cape May Courthouse, and Manahawkin. So what is smartphone thumb? To be completely honest, this is not an official medical term at all. You may recall the term BlackBerry thumb, which was some sort of thumb pain that was brought on by too much BlackBerry use. I'm going to talk about 3 common conditions that cause thumb pain, which have not been proven to be caused by phones, but they can absolutely be made much worse with phone overuse. These conditions are called trigger finger, de Quervain's Tenosynovitis, and thumb basal joint arthritis. The first is trigger finger. This occurs when there is locking and catching of the finger. The finger gets stuck in a position like this, most commonly in the morning, and has to be forcefully extended to get it out straight. This is caused by a mismatch in the size of the finger tendon and the pulley system that holds the tendons in place. Also referred to as stenosing tenosynovitis, the pulley here becomes enlarged, making it difficult for the tendon to slide smoothly under it. It is present in 2 to 3% of the general population, is more common in patients with diabetes, and more common in females than males. There are many medical conditions that predispose patients to developing trigger finger, some of which are listed here. It usually progresses from a subtle ache to a clicking, then the finger actually gets stuck in this position. Fortunately, there are effective treatments for it. They can slowly resolve on their own with the help of splints and anti-inflammatory medications. But the mainstay of non-operative treatment is a steroid injection. Typically, we try at least 2 injections before talking about surgery. It is important to know that blood sugar can be affected by the injection for several days afterward, but overall, injections are typically very successful in treating this condition. For the surgery, the pulley that is causing the problem is released through a small incision in the palm. And I won't go into too many specifics about the surgery, but it is typically a quick procedure with a recovery time of only a few weeks. The next important thumb problem is called Quervain's Tenosynovitis. This has gone by many different names in the past and is believed to be the original smartphone thumb, BlackBerry thumb, Wii-itis, Nintendinitis, and even called mommy thumb. It is most accurately called tenosynovitis of a group of tendons that help move the thumb near the wrist. It is more common in women than men and can be associated with trauma and is common during and soon after pregnancy, hence the term mommy thumb. This layer of tissue under which the tendons pass can be thickened and scarred. It usually develops slowly and can be quite debilitating when trying to lift things like a gallon of milk or a newborn baby. There is pain on the thumb side of the wrist, and there are specific maneuvers that can really aggravate it. For treatment, there are great options for bracing and anti-inflammatory medications. If those do not help, steroid injections are also another option. If those fail, there is surgery, which releases the thickened pulley system to alleviate pressure on those tendons. And lastly, arthritis of the thumb. This also goes by several names. It is arthritis of the trapeziometacarpal joint of the thumb. It is also very common and can be present in 25 to 40% of adults who are older than 70 years old. It has a typical appearance, as you can see here, where there is abnormal alignment of the thumb. The entire thumb can be affected as the condition in the basal joint of the thumb worsens. X-rays can help confirm the presence of the arthritis, but the treatment is mainly guided by the severity of the symptoms. Fortunately, treatment starts with non-operative management, which includes a wide variety of braces, specific thumb exercises, anti-inflammatory medications, and also steroid injections. If those treatments fail to help with symptoms, there are surgeries which remove the trapezium, which is the bone that is causing these symptoms. Once the trapezium is removed, there are several strategies to help stabilize the thumb, all of which have been shown to be successful. In conclusion, it has not been proven that any of these conditions are caused by smartphones. But overuse of a phone can absolutely worsen any one of these conditions. In order to most safely use your phone, you should try to avoid using it too much to begin with. Try hands-free devices whenever possible. Try alternating hands as much as possible. But if you do have to use it, try to keep your hand and wrist in a neutral position like this. But overall, if your hand or thumb is bothering you, first try limiting the activity that is causing it to bother you if you can. And next, you can speak with your primary care doctor or call any one of the hand specialists at Rothman at any time. And there's a lot of information out there on the internet, including me trying to explain these things to my friends Mike and Alex on Fox 29 in Philadelphia a few months ago. But hopefully now you have a better understanding of common thumb problems and how they can best be treated. And with that, I wanted to thank you for listening. I wanted to leave as much time as possible for some questions and answers from you. Here is my contact information along with Melanie's, who is the person that put this all together. If you find yourself needing an appointment to see a hand specialist, don't hesitate to call this 800 number and they will get you where you need to go. So I think it is time for some questions, and feel free to continue asking questions as we are chatting.
Dr. Hozack, thank you. I think it brings the relevance to how much we use our phones and realizing that it can be such a common problem. So we just thank you so much for just sharing this with us. And again, if anyone wants to make an appointment with Dr. Hozack, please call us at 1-800-321-9999. I see that we do have a question here. Why more women over men have this disease, so-called disease, or?
Currently, there's still actually research as going into exactly why that's happening. We do know just from the number of people that we see and treat, there's a certain percentage that are men and certain percentage that are women, and it's more often women. There are theories that hormones do play a role in the laxity and around joints and around tendon sheaths, and that may have something to do with the aggravation of certain joints and certain tendon sheaths around your hand and wrist. But overall, since we do find that this is a more common complaint with more females than males, we typically tell people that it is more common in females than males, and just to give them a heads up that it can happen with pregnancy and after pregnancy when hormones are obviously changing a lot. So obviously it has something to do with it, but the research is still going on to exactly why that's happening.
How about the age group that you do see for these conditions? Is it more common in the younger age group, maybe let's say between 18 to 30, or do you see it more common issues with 30 and above?
It is typically in older populations than that, typically in 40 to 50-year-old plus for the trigger fingers, and with arthritis is typically older than that. For its 50 to 60 plus, I think the stat I showed was once you get to be above 70 years old, about 30 to 40% of people will have some sort of thumb arthritis, with the trigger finger and the Quervain Tenosynovitis being the slightly younger group from around the 30 to 50-year-old age, but it could affect anyone at any age at any time.
Okay. A good question. This attendee has a steroid injections for trigger finger, thumb and middle finger, and right hand. And now when I wake up, my thumb is sore and the middle finger is stiff. Is there something I can do before I go to bed, prevent this from happening each morning?
Seeing as sounds like you're currently being treated for trigger fingers, first make sure you're checking in with your primary care doctor to see how your health is overall. Because typically if we see multiple digits triggering and they're recurring, you may need to make sure you're checking in on if your glucose is under control, if you're having any thyroid issues or anything like that, or depending on your profession, you could be a little just rough on your hands causing these things to pop up. But it sounds like they are just recurring, and it's tough to prevent them actively from recurring once they're happening. We do suggest trying to make sure get your health as good as you can, get your sugars under control. But typically once they start developing, it's a little tough for them to settle down, other than some anti-inflammatory either pills, or you can even use some anti-inflammatory creams that sometimes help. But like I said, that if they do improve with those, it does take a good amount of time, and sometimes it's a little intolerable to wait, that 6 to 12 months for them to go away on their own. So it's worth checking in with your primary care doctor, and you can always go see a hand surgeon to get it looked at and sometimes it takes 1 and 2 injections to get them to go away. But if they keep coming back, that's when you start talking about maybe needing surgery for it.
Okay, she did mention she has, things that she's getting checked in with her PCP, and she types all day. So that could be also, I guess, an annoyance to the situation. There's another question is, what are the best types of thumb braces and how long do you wear them for?
Like I said, there's a wide variety of the thumb braces, depending what the complaint is. Typically for the Quervain, Tenosynovitis, you have to have a brace that goes down to your forearm and into your thumb, because it has to immobilize your whole wrist and thumb. So that can be a little tough. You basically can wear it as much as possible when you're having the symptoms, which obviously can be a little tough if depending on what your job is and just daily activities. That's when we talk about thinking about injections and some anti-inflammatory creams or medications. For the arthritis, there's a wide range of them, and people have different preferences depending how they fit. There's some more sturdy ones that just include your hand and go to your thumb tip, but there's others that can be custom made and custom molded to your thumb. We frequently refer people to hand therapists who specialize in therapy for the hand. And there's several around this area that we always send people to, and they typically have very good outcomes once they get that joint immobilized. And a lot of people do try a few different types of braces before they find one that they like. So there's not one specific brace. Some are over the counter, some you can just find on Amazon. Otherwise, a hand therapist can actually custom mold it to your thumb and basically just try to wear it as much as possible, especially if your thumb is aching. Try to wear it during those heavy activities and see if that helps. But if it's not helping, then you can come in and we can go over some other options for sure.
Someone mentioned that for women with arthritis, they do sewing, crafts, can openers, hands in a water, a lot, detailed things. Sometimes having our hands in those positions hurts. I'm 58 and I do a lot of cooking and very hard with pots and pans and lifting things out of the oven. I guess she's just mentioning all these different tasks that I guess affect her hands, and maybe what can we do with those, like to make alleviate some of the pain.
Yeah, any sort of pinching puts a lot of stress on certain joints of your thumb. A few pounds of stress at this point here, if you're pinching down on something like a sewing needle or kitchen utensils, or just something with any profession, honestly, it basically gets multiplied to this joint, and it's even more stress at this joint and even more stress down here where that arthritis is. So that act of pinching, opening cans, opening doors can be pretty painful if you're starting to develop arthritis. And that's when a lot of times when people are having issues with those daily activities you're doing all day, every day, can be pretty rough. And if you can't function in the house, then it can be pretty tough on you. So that's when we start talking about trying those braces first, because it can help stabilize that and give you a little bit of a guard to make it a little more stable when you're making those movements. And then we can talk about other treatments if that's not working. But that's a very frequent complaint, just that pinching action and any activity you're doing, that's going to be what's really going to aggravate that thumb arthritis.
Okay, another attendee mentioned, I had trigger finger in my pinky due to overuse due to painting with a roller. I received an injection a few months ago. The pinky no longer sticks, but now it hurts again. My wrist also hurts when I press on a soap dispenser. Are there stretches I can do to help for the pinky and the wrist?
It's tough to say when you're saying it's hurting, where exactly it's hurting. But if you've had trigger fingers in the past, I'd always be worried about that it's the trigger finger coming back, whether it is that pinky or the thumb. And like I said, with the thumb, sometimes it can kind of feel like wrist pain, even though it's the bottom of your thumb. But you could also have something else going on in your wrist. So it's something worth getting checked out. But first thing I'd worry about is a recurrence of the trigger finger, even though it's not triggering. There's typically an aching that happens first before it starts triggering again. But also you could be having some early arthritis or another tendonitis issue or a problem in your wrist too. So it's tough to say, but could be any one of those.
So would you recommend any type of like hand stretches to like maybe just do at home for these?
It's tough to say what exactly is giving you the problem. It doesn't sound like it's a stiffness problem. It sounds like, you are aggravating something. So it'd be tough to say a specific exercise for what the complaint is. But if it's trigger finger, it's a pretty tough. The way to make it go away is to rest that finger, but it's very difficult not to be, using your finger. That's why we have these treatments ready for it.
Is there something that someone can do for trigger finger before resorting to an injection?
Like I said, if you can try to rest your finger or try to live with it triggering like that, there is a chance it will go away, but some studies have showed about 40 to 50% of them can go away, but it takes 6 to 9 months for that to happen. So depending how symptomatic it is, some of them are clicking and not causing any pain, and some people can just live with it. But other times, if it gets locked in place and it's hurting, it's very difficult to live with that for more than just a few weeks. So there is a chance it'll go away. But again, like I said, if you are having a lot of trigger fingers, it's a good time to maybe check in with your primary care doctor, make sure your health is okay, if your sugars are okay, and then try to rest that finger. But the way it is, it's tough to not use your finger for certain activities for an extended period of time.
Okay, this is a broad question. So this person asked a question about, I got a steroid injection in my wrist, which lasted about 6 months. After this, the pain has been coming back with swelling and sharper pains. What do you suggest the next steps are?
Well, it's tough to say where exactly the injection was in and around your wrist, but whatever that issue was that was causing that pain that made you have that injection may be something that's recurring. And it's good that injection, which is, the steroid injection is a strong anti-inflammatory medication. So you basically took a strong anti-inflammatory medication for that wrist specifically, and it helped, which is great, but it sounds like, that issue may be coming back. So it's worth considering. Maybe you can always try immobilizing that wrist to rest it. Otherwise, you can try some anti-inflammatory medications, whether that's medications or creams, and then think about another steroid injection. Although there's a lot of locations in your wrist you could have received the injection, so I wouldn't want to say you need another one. But it's just the same reason you had that injection. It may be coming back.
Okay. Is there any over-the-counter medication that you would suggest?
There isn't one magic pill for any of this, but when I do talk about anti-inflammatory medications, obviously there's over-the-counter ibuprofen, Motrin, Advil, but you have to be careful with those because there are side effects with those. You can have issues with your stomach and also with your kidneys with prolonged use. And if you have any medical issues, you'll always check in with your primary care doctor if you're thinking about taking those long term. There are some anti-inflammatory creams. There's a wide variety of them. I don't think one brand is better than the others, but that does give a little lower dose, and you can put it exactly where you need it and just when you need it. So sometimes those creams for the hand, I typically recommend more so than the pills, just because it goes exactly where you need it. And it's a much lower dose that gets into the rest of your system. So typically it's in that pain medicine section, but the anti-inflammatory creams are something that sometimes can help people for sure.
Awesome. Well, Dr. Hozack, I think that's all our questions for this evening. And thank you for attending and sharing this interesting information. I'm sure all of us have dealing with it in some shape or form. Again, if you would like to reach Dr. Hozack, The information is on the last slide, but you will also receive a follow-up email with the recording within about 5 to 7 days. And again, feel free to reach out to either one of us and we'll be happy to assist you in any way that we can here at Rothman. Thank you, everybody. And
Thank you very much.